Future healthcare policies is also expected to dominate 2018 elections, including the race for Minnesota governor. In a crowded field of 6 announced DFL candidates, one candidate appears to be making a clear play to lock down progressive supporters. State Auditor Otto in recent weeks has proposed an environmental policy that includes a tax on carbon emissions. And when it comes to healthcare, she is calling for universal healthcare coverage. State Auditor and DFL candidate for Governor Otto joins us now. Thank you so much for coming in.
My pleasure. Thank you.
All right. Well, let me ask you, last year in the Minnesota caucuses, Bernie Sanders crushed Hillary Clinton more than 20 percentage points. Are you going down that line and trying to lock down people who supported Mr. Sanders?
Here's what I'm working on. I'm working on an agenda that will be meaningful for all Minnesotans statewide. And my policies are informed by a listening tour that I launched in January. I didn't launch a speaking tour, I launched a listening tour when I told people I was running. And as I traveled the state, in all communities there were certain themes that came up. And so my agenda is getting at the themes and the concerns that in people's hopes and dreams about the future of our state and changes that need to be made which will improve our lives.
All right. So much going on in the area of healthcare, so much uncertainty, the president's announcement just in the past few days. Your universal healthcare plan, as I understand it, no premiums, no deductibles, everyone would have access to basic healthcare coverage. It sounds great. How is it going to work? Who's going to pay for it? And how are you going to get bipartisan support for it?
I'll tell you why I'm really hopeful, because when I have Republicans telling me they want single payer, and I had a gentleman who was a 3-generation businessman, the time is now. We're at a watershed moment, and President Trump continues to highlight that because we have healthcare insecurity right now, and it's tied to your job, and we're paying more than we need to. And so my plan, yes, it does all that. What we're going to have to do is get waivers from the federal government. We're going to take all the existing healthcare funds and we're going to put them into one big fund that's protected. And then we're going to leverage the good things in our healthcare system with our providers. And we're going to turn the system on its head because we're basically going to put the patient and provider back in the center of healthcare so that you get to choose who you want to go to. And they are going to focus on health outcomes. And we're going to get rid of a lot of this coding and billing and a lot of the administrative burden. We can squeeze inefficiencies out of the system. It would be best if they combine the programs at the federal level. I don't have any confidence in the federal level getting anything done right now.
Right, but let me ask you, isn't this going to require a tax increase?
Well, if you take the existing...
I mean, you suggested that it has in some of your statements.
If you take the existing healthcare dollars, all the public funds, which is actually quite a bit of the system, our system's been evolving for some time. And then you take there's employers that have their own plans and they have dollars they're spending. Put all those dollars into one place, and then there's a small bit of our population that has been buying private insurance. So it's taking what we're spending and doing a much, much, much better job squeezing out the inefficiencies, squeezing out the administrative burdens, and moving away from fee-for-service to a fee per enrollee, and our providers are focusing on keeping us healthy, not on procedures.
All right, let me ask you about your environmental plan. The National Association of Manufacturers says that a plan such as yours that would tax carbon emissions would result in an increase in 20 cents a gallon for a gallon of gas, 40% more in cost for natural gas, and 5% more for electricity. Is that a plan really people can afford?
Well, that's an interesting, I haven't seen that particular claim. What I can tell you is that we have thought through this plan very, very carefully, and we're going to place a price on carbon. It's not a tax. We're not taking money out of the economy. It's revenue neutral. And we are going to empower all Minnesotans to change what they're doing and to take charge of their energy future, and that we're going to use free fuel forever. The sun is free. We're not relying on Middle East and letting them jack around prices. So it's really, it's allowing residents, whether you're in an apartment building or a home, to take advantage of solar, whether it's a solar garden or something on your roof, to take advantage of heat pumps, which are much more efficient. And the economy is already going this way. And so, yes, could the price of fuel go up? Absolutely. But we're going to empower Minnesotans to move away from using those fuels.
Quickly, if you do not get the DFL endorsement at the nominating convention, will you drop out of the race?
My plan is to abide by the endorsement, and I'm working hard for it.
All right. State Auditor, gubernatorial candidate Otto, thank you so much for joining us.
Thank you.